Okay, today we're going to cover the integrated process flow that was designed by the VA DoD for substance abuse treatment. We're going to select the client, and then after we select the client, we're going to select the process flow. Now, within the process flow, again, these guidelines were developed by the VA DoD. These are the clinical practice guidelines for management of substance use disorder. We see that all patients are seen in a general medical setting. Then we check to see whether the patient requires acute medical or mental health stabilization. If not, then we continue down the flow. Does the patient have signs and symptoms of any substance use disorder or for alcohol or tobacco? If they do, then is treatment or further evaluation indicated and acceptable to the patient? If not, then we continue with an annual screening and we determine whether the patient screens positive for mental health stabilization. If they do, then we follow this path for treatment. Now we're going to scroll down a little bit and we'll see that the first thing we do is we'll confirm the current alcohol consumption level, and does the patient meet or exceed the recommended limits. Now for an adult male, that limit is 4 drinks per day, but we can check it by looking at the sidebar. So we have various sidebars included within the process flow. Sidebar 1 gives us our limits for alcohol consumption. Man age 65 or below, his drink limit should be 4 per day or 14 per week. A man above age 65 and all women, their limit should be 3 drinks per day or no more than 7 per week. If their drinks exceed this amount, then we have an indication, a positive indication. So here, as we continue down the path, we want to know whether the treatment and further evaluation is indicated, and then we can offer a referral for management or in primary care or to another specialist setting. Now here's where most of the substance abuse programs begin. They have to do a complete biopsychosocial assessment and determine the DSM-5 criteria, using the DSM-5 criteria. And we have 2 methods to accomplish this. We can either do a comprehensive evaluation. If we click on the icon, it launches you into the behavioral health comprehensive assessment. We can do a psychosocial assessment, family history, substance abuse history. We'll look at their review of psychiatric systems. We'll look at the various current stressors. So we can complete a good biopsychosocial assessment. Otherwise, we can actually use different forms and documents. Here we have an assessment. We can use various assessment tools. Within the state of Maryland, we have TAP. Within other states, we'll use the GAINS, either the short screener or the GAINS long tool. And here we have KRC, which is actually their assessment tool for Kitsap Recovery Center in Washington State. So we can actually click on the document and complete the document. Now the software allows you to add any number of forms or documents that can be also incorporated within the process flow. Some agencies may use an assessment tool, an intake registration document. They'll do an ASAM, PPC 2R, which is just determine the level of care that's required. They'll also use the ASAM cross screener. So various states have different forms that they will use, or different jurisdictions, but all the system allows you to specify the form that meets your state guidelines. So next we'll go down to develop and implement a comprehensive treatment plan. Now we have several tools that are available for this, but we'll look at our ASAM based treatment plan tool. Now the tool that we've incorporated into the system has over 1,300 selections within it. Now it's arranged by different dimensions, so each problem can be identified through the click down or the drop downs, and you know your ASAM 1 has to deal with withdrawal, ASAM 2 biomedical conditions, ASAM 3. So each of the 6 dimensions within the ASAM will have unique problems. Then there's goals, there's objectives, which are more like intermediate or short-term goals, and interventions, which can be identified. Again, we have over 1,300 selections, and they are identified by the actual ASAM dimension, and they are problem focused. If you have more than one problem within a dimension, you just click the plus button and it adds a space for you to add additional problems. Within each dimension, you can track up to 6 problems, or a total of 36 problems for an individual. Once you hit generate, then the system generates the master treatment plan, dimension number, the problem date, the current, the goals, the indicators, the client strengths, and interventions. So that's actually generated and stored within the patient's chart within minutes. Now we can go back to the process flow, and as we use this process flow, we can come down and see whether we're going to offer pharmacopathy. We can use sidebars 3 and 4, and they will actually show you some of the different detail for pharmacological management. Then we can look at psychological interventions. We can also address psychosocial functioning. We can use different tools and forms for that. And then we can get down to the bottom and see whether the patient's needs have been met or they need continued substance use disorder treatment. If yes, then we can loop back through and refine the plan. If no, then we can go to an annual screening. And that is the VA DoD clinical guidelines for management of substance use disorder. Thank you.